What drives this movement? So does this happen by itself? What is actually causing this movement of the fluid? Well, something has to move, right? Well, I did hint at it earlier. I did hint that the ventricles squeeze. So let's look in this even deeper. So now we're going to zoom in on the tissue, and now we're going to look at a section of the heart wall. And this is from the Martini version, and it's a little more detailed than the OpenStax version, but let's zoom in. So what we have here, let's orient ourselves. This is the inside of the heart, and this is the outside of the heart. Now, this is what we have here. So remember, anatomical directions, you should know this. So superficial, remember, like people who are superficial, they're only concerned with outer appearances, right? They're only like very shallow. So superficial is also like roughly meaning outside or outer. And the opposite is deep, sometimes called profound. And so what we have here, the outside of the heart and the inside of the heart. So going from the outside, working our way toward the inside of the heart. So we have this little membrane called, or not little, I should say, we have a membrane layer called the pericardium. And there's a little gap between the pericardium and the next layer. So this is what we call the pericardial cavity. We'll get to more to that, I think, hopefully by the end of this lecture, if not next week. Then you have the epicardiums, that's across the pericardial cavity. And actually the pericardium, epicardium are actually continuous with each other, but if you're taking a section like this, it looks like two separate layers. Then you have the myocardium, and whenever you see that root word or anything with MYO, that refers to muscle. So that's kind of a hint. Cardium refers to the heart, myo means muscle, so this is a muscle of the heart. And then you have the endocardium. Hey, epi and endo. So remember, epi and endo are also prefixes. When you have something that's epi, that's more outer. Whenever you have something that's endo, that's more inner. So this is where knowing these root words and knowing these directions are very useful. So these are the layers of the heart. You definitely should know this. But what makes up the majority of the layers of the heart, or in terms of the bulk and volume? Well, let's look at another. So this is a histological cross-section. Now we're looking at a microscope, an actual cross-section. So notice that the epicardium, it's a layer on the outside of the heart wall. And the myocardium, very thick. And the endocardium, relatively thin. So the myocardium is the thickest layer by far. So this is what the heart wall is. It's mostly muscle. It does have other layers, but the bulk of it and the bulk of its functional layers is the muscle tissue that contracts. Now, let's look at this muscle tissue even further. Now, what does this muscle tissue look like? So it has all these heart muscle cells, also called cardiomyocytes, and they're all connected together. But notice that instead of like, if you were here last semester, if you remember that skeletal muscle, it's all these parallel fibers, but what we have here in cardiac muscle, it actually forms more of like a mesh-like network. And it has these special things called intercalated discs that connect each heart muscle cell. Now what we see here is that within each heart muscle cell, we have these things that are holding them together. Oh, A bands and I bands. If you were here last semester, where have we heard that before? Maybe things like actin and myosin and sliding filaments. So what we have here, A bands and I bands. Now, do I want you to know the entire cross-bridge cycle? Maybe not so much in depth this semester, but what happens with actin and myosin? Here we have all this actin filaments. Here we have all these myosin heads. So when you have actin and myosin interacting, what happens? The whole thing contracts. So again, if the sliding filament theory, if you have a relaxed muscle and then you have actin and myosin interacting, it kind of pulls each other and then it contracts the whole muscle. So you have a muscle shortening. Now let's zoom out back to the whole heart again. So this is that was happening at the molecular level with the actin and myosin. And again, if you don't remember that, maybe go back to my muscle tissue lectures on my same channel now. All right, so then what we have here, go back to the tissues. So this is what your heart muscle would look like if you took like a transverse horizontal section and looked at it from the top. It would look like this, relaxed. And then what would happen when it contracts? When it contracts, remember, when muscles contract, they shorten. So if you take a purse string or like a drawstring bag and you start shortening it and contracting it and tightening it up, it's going to purse and kind of get smaller and smaller, right? So that's what happens with your muscle cells. They contract and get smaller in diameter, and you notice it also gets thicker as well. So this applies the pressure that allow, especially in the ventricles, that allow blood to shoot from the ventricles up through either, again, the pulmonary artery on the right side or the aorta on the left side of the heart. Now, there's also the theory, and that's actually a really cool video. So what happens here is that the heart is actually like a tube that kind of folds in on itself. And this leads to what we call the myocardial band or helical heart theory. I put an asterisk because I don't expect you to know this, and there's this, he's kind of controversial in the cardiology research field, but what he's doing right here, this professor, I think he might have passed already, but he was called, I forgot his first name, but his last name was Torrent Guasp. And what he's doing is taking a heart and unfolding it into one continuous muscle. So this is, even though like this unfolding part is actually the controversial part, but what I want you to know is that all the heart muscle works together. There's not individual fibers. The entire heart works as a single muscle. It's not like just like, okay, it does contract at different times, but the whole heart needs to work as one continuous unit. Now, thing is that let's compare with skeletal muscle, which we covered last semester. So we have skeletal muscle and cardiac muscle. So yes, the heart is one muscle. So I like to draw an analogy. So here we have a bunch of bungee cords that are individual, and then cardiac muscle is more like a network. And again, because skeletal muscles, the individual myofibers, they're parallel and then they form the fascicles, but they're not actually weaving into each other like cardiac muscle does. That's one big difference between skeletal muscle and cardiac muscle. But another big difference is that in skeletal muscle, you have those things called motor units. So individual muscle fibers can contract. If you want a very small, contraction with a very small amount of force, maybe only one of these fibers are going to, or a few of these fibers are going to contract. But if you want more force, maybe you're going to recruit more of these fibers and cause more of them to contract, producing more force. So it's kind of like the difference between giving your friend a playful punch versus totally knocking them out. So again, it's all about how many muscle fibers you're actually recruiting. Now, cardiac muscle, you can't have the individual fibers contracting. The whole thing needs to be coordinated. So again, when we cover the cardiac cycle, you notice that okay, it doesn't mean that all the muscle cells contract at the same time. It actually occurs in a more wave-like pattern, and again, like the atria and ventricles don't contract at the same time. But in the end, with each heartbeat, the whole heart should have contracted at one point during that one cardiac cycle. So I can't really pick and choose which muscle cells and fibers. It's not going to say like, okay, only these cells are going to contract in the ventricle versus like the whole ventricle altogether. So I can choose areas that contract, but in the end, with every heartbeat, the whole cardiac muscle has to have contracted at one point. So again, skeletal muscle fibers contract, but in a cycle, or in a single heartbeat, the entire cardiac muscle must have contracted at one point.